Today, let's talk about factors associated with complications in ST elevation myocardial infarction, a single center experience. ST elevation myocardial infarction is a major public health problem. This study aimed to determine the prevalence and identify the determinants of STEMI related complications in the Cardiology Intensive Care Unit. Coming to the methods, the data of 315 patients with STEMI aged greater than or equal to 18 years were analyzed. Logistic regression was used to identify factors independently associated with the occurrence of complications. Coming to the results, overall 315 patients aged 61.7 plus or minus 13.4 years, of whom 261 were men, had STEMI during the study period. The hospital frequency of STEMI was 12.7%. Arrhythmias and acute heart failure were the main complications. Age greater than or equal to 75 years, hypertension, and cigarette smoking were independent determinants of acute heart failure. Meanwhile, diabetes mellitus, history of atrial fibrillation, history of stroke or transient ischemic attack, and low high density lipoprotein cholesterol levels were independent determinants of arrhythmias. To conclude, STEMI is a frequent condition at SFHC and is often complicated by acute heart failure and arrhythmias. Patient age greater than or equal to 75 years, those with hypertension or diabetes mellitus, smokers, those with a history of atrial fibrillation or stroke, and those with low high density lipoprotein cholesterol levels require careful monitoring for the early diagnosis and management of these complications.